Welcome everyone. My name is Diana Vargas Garcia. I am a registered nurse, and during this presentation, I'll be talking to you about the new system of prefilled syringes. We would like to implement the prefilled syringe system in our operating room in order to reduce patient harm and reduce costs for the facility. I'm going to discuss about the medication administration system that is currently used and its effects, which are medication errors and adverse drug events, patient harm, and current facility cost. I am also going to talk about the solution to these problems, which is a standardized prefilled syringe system. I am going to talk about the budget, and I'm going to wrap up with the benefits that this system offers. Let's start with medication errors and adverse drug events. Because anesthetists and anesthesiologists are responsible to handle, prepare, and administer medications without secondary verification, they are very likely to commit errors. The Joint Commission issued a standardized system where medications are to be labeled and stored meeting certain criteria. This system requires the compliance of providers. Because of this, a lot of errors are still occurring. On an article wrote by Lindsey Brown, a nurse anesthetist at the Texas Medical Center, she mentions that approximately 50.4 medication errors in the operating room are the results of drug syringes and preparation errors. This includes syringe swaps, incorrect vial selection, and syringe labeling errors. Now, when patients are undergoing surgeries, anesthesia and other medications put them at risk for developing complications. If on top of that, medications are administered by error, whether it's too little or too much, or not the indicated medication, these put patients at a much greater risk. Some of the risks are heart arrhythmias or malfunctions, organ damage, traumatic brain injury, asphyxia, birth defects, spinal cord injury causing paralysis, coma, and death. Now let's talk about the incurring facility cost. Medication errors represent a huge financial burden for the healthcare system as it increases the risk for patient harm and the need for further and specialized care to treat the results or side effects from those errors. This means that more hours from healthcare professionals dedicated to treat and observe the patients are needed. Also, there might be the need for specialized equipment, the use of other drugs, and the need for longer hospitalization. All these represent extra expenditure for the healthcare facility and for the patient. According to the Network for Excellence in Health Innovation, incorrect dosing makes up to 37% of all preventable medication errors, and drug allergies or harmful drugs interaction makes up to 11%. The annual cost for inpatient preventable medication errors is of approximately 16.4 billion and 4 billion for outpatients. By using the prefilled syringe system, we would be able to provide safer medication administration, we will have less chances for errors, and we will save time and money. These are some of the advantages that the prefilled syringe system offers. It reduces the risk of medication errors as they have clear labelings, and in conjunction with the electronic medication administration system, it provides a safer way of medication administration. It reduces the risk of medication errors as they have clear labeling, and in conjunction with the electronic medication administration system, it provides a safer way to administer medication. It also improves patient outcomes since medication errors are less likely, thus, patients would have better experience during hospitalization. The prefilled syringe system also reduces the cost related to waste medication. Because syringes are filled and dispensed in different sizes and in different amount of medications, Anesthetists are able to utilize the amount of medication they need if they choose the right syringe with the right amount of medication. That way they don't have to waste as much medications as if they would by filling up syringes from vials. As we can see, this system overall is a safer system. This chart shows how the implementation of prefilled syringe system has changed the amount of wasted medication and the cost in relation to it. As we can see, lidocaine is one of the most used medications, which is normally 3,200 milligrams, and the cost for that is $87.36. With the use of prefilled syringe system, 300 milligrams are used, and the cost for that is $10.56. And that represents a 90.6% reduction of wasted medication. And this applied for many other medications. Here we can see the different type of syringes used for prefilled syringe medication. Now let's talk about the budget. Since I used the first example of lidocaine, I'm going to continue use it in this slide. The average cost for a prefilled syringe with lidocaine is averaging $5, and that's for a syringe of 2% lidocaine of 20 milligrams per milliliter on a vial of 5 milliliter. In comparison to that, the cost of a vial is $7, the same amount, the same strength. Since there are a full list of medications used in the OR, the cost of the total amount used for prefilled syringe medications depends on the amount of medications to be ordered and the type of medications. Apart from that, $2,000 is the price for single package needles. Since many of the prefilled syringes come without needle, extra needles are needed. Now, the salary for project manager for 10 months part-time is of $28,000. The cost for the project team is $3,000. Training costs $5,500. ITI services is $1,500. And the total is $40,000 plus the cost of the medication. To wrap up, with the prefilled syringe system, we have safer medication handling and administration. It is cost-effective, time-saving, labor-saving, saving in wasted medication, and improved patient care, and therefore patient satisfaction. That's all I have for now, but if you have any questions, I will be happy to answer them. Thank you for listening and for your interest.